When the patient arrives at Charlotte Maxeke, they either come undiagnosed or they arrive here to be diagnosed. The entire treatment plan, the holistic nature of how this patient is being received, managed, treated, and cared for rests at your door.
A lot of patients who come to our hospital, who, by the way, come from near and far, the 14 hospitals that refer to us, other provinces that refer to us, is very important. On an annual basis, we diagnose about 4,500 new cases. And this is done through a multidisciplinary approach, where in many of the clinics where patients have a potential to have cancer, the question is asked to the patients.
I was first diagnosed with a cervical cancer 2B. I was in the stage 2B. And then I took the treatment, the whole treatment, and after the treatment I was happily healed.
About 2 years ago, the radiation oncologists are working with the medical doctors in other areas to purposely ask men about their prostate cancer. And we have seen a rise in the diagnosis of prostate cancer since we started proactively in asking men about their status. The second part that we try to do, we also do mammograms for breast cancer, because these two cancers are the ones that are really treatable if diagnosed early. So many departments are really trying to encourage people to know their status, but once you know your status, they also help you where to start in terms of this disease.
Ifamily yami in Eastern Cape batshone ngenxa ye-cancer. So when I've heard that I've got cancer, I also thought of myself that I'm gonna die. Uma ngizwa ke bathi sengine-cancer uDr. Smith, but wangihandla ngendlela e-right, wangithatha wangibeka etafuleni. So ngithe mangivuka lapho sengikhala ke wathatha amathishu wangisula wangitshela ukuthi ngizophila.
One of the things we picked up was in a small little interview with a patient who had a beautiful experience in this hospital, is that impression was created not by the equipment, not by the machine, but by the people using the equipment.
This is new technology that is out there in the whole world. It is a state-of-the-art machines. I'm not sure if anybody has them yet in the country, but these machines are actually much more focused in terms of treating the patients, and I'm told that the technology that is in this machine, it actually goes directly to that small little cancer cell that is there, and if in the event the patient moves a bit, it actually stops because it only wants to radiate what is a cancer cell only. So that is really amazing in terms of the work that we will be able to do with these new machines.
As an institution, as an academic institution, can you tell us a little bit about the programs and the consistency with which you are seeking to maintain awareness campaigns?
If you come today at Charlotte to be diagnosed, by the time you go home, you will be knowing if you have a potential of cancer. And it's through multidisciplinary work of the surgeons, the radiologists, the radiographers, the oncologists, radiation oncologists, that work together to ensure that the early detection of the disease is taking place. Lastly, as a teaching hospital, we have a lot of research that is going into the latest treatments in cancer, how it impacts on other diseases, and most of the research actually does influence policy in terms of the outcomes of this research that has been done as a teaching hospital.